Hi guys, this is blood transfusion video 1. First of all, you need your order. If you are transfusing multiple components at a time, the doctor will specify the sequence of which the components will go in. The order will also specify any pre-medications that will be given before transfusion. 2, blood typing. We need to know their compatibility, their blood type, and so forth. Selecting equipment. Always for blood products, we're going to use an 18 gauge or a 20 gauge. For plasma, we use 22. Forcing blood through too small of a tube or a damaged tube can cause lysis of the cell, which is rupture of the cell. And that's why we use the size of gauge we do. So if you're using like a pump, which I'm not sure really, if you decide to use a pump for some reason, you are at risk for rupturing the cell. Okay, if that makes any sense at all. All right, so if medication is needed during blood transfusion, then there needs to be a second IV line started. Never mix blood and medication or another fluid together. You always want to use 0.9% sodium chloride. That's the only fluid that's compatible with blood. So the administration sets, we use a Y-type tubing. So it's like a Y shape, has 2 ports, I believe. So that the 0.9 sodium chloride can infuse before and after the blood. So in one port will be the blood and another port will be the sodium chloride. Next, blood administration sets come with a filter to remove debris that accumulates in stored blood. All right, blood warmers. Blood warmers are only needed in certain situations, such as if you're getting a massive rapid transfusion, exchange transfusions, and patients with clinically significant cold agglutinin. Hey, Roy. Hi. This is my puppy. Okay. Next, you want to prepare the patient. So this is when our ADPI comes in as our assessment. So we want to assess their understanding of this procedure, how long it's going to take, why they're getting it, and any concerns they have. Next, an informed consent should be signed. And you would want them to report any different sensations they have after transfusion has been initiated. Also going back to the assessment part of it. So before we give the blood, we want to assess we want to do a thorough assessment on the patient. We want to get their vital sign, baseline vital signs, consent. Where am I at right now? All right. Here we go. Okay. Baseline vital signs. So that we don't confuse in any symptoms they have. So that we don't confuse those symptoms as a blood transfusion reaction. So, yeah. So any vital signs such as, respiratory, blood pressure, temperature, and so forth. Next, we want to get informed consent. Okay, and then patients should be asked to report any different sensations they have after transfusion has been started. Since transfusions, they're going to be sitting there for a couple hours maybe, one of our priorities is going to be patient comfort, because they will be sitting there for so long. Blood transfusion should not exceed more than 4 hours. And then before you initiate the blood product, we want to give any pre-medications to help keep their vital signs normal. Okay, next, obtaining blood work from the blood bank. So never ever keep blood in the fridge. They should always be kept in containers that they come in. And if blood is obtained from an on-site blood bank, it should be administered within 30 minutes or returned back to the blood bank for proper storage. So, and then it also says here that if you obtain the blood from an on-site blood bank, then you should not, then you should only be getting one product at a time. And then, yeah, using it within that 30 minutes. So just always obtain the blood when your patient's ready to actually get the infusion. Never ever use refrigerators. Okay. Verification. So, you know, we want to make sure that all the information is the same on the blood request form, the blood bag label, and the compatibility tag. I'm sorry, I'm losing all my trains of thought. Request form. So then this blood product request form will become part of their permanent patient record. Oh, and then they said in this that it sometimes is helpful if one nurse reads the information for verification to the other nurse as the nurse checks it. Also, the color, appearance, and expiration date of the component must be checked. The name of the person issuing the blood, name of the patient, and date and time, oh my gosh, must be recorded.
What are you doing in there?
I'm making a video for my class.
Oh, okay.
You want to verify before you infuse it, you want to verify with another nurse, and this can be an RN or an LPN. All right, so let's get to the actual, you know, administrating it. So like I said, we're going to have that Y set with the 2 ports. You're going to spike the blood container and hang. You want to turn off the 0.9 sodium chloride and turn on the blood component. So like I said before, you want the sodium chloride to flush before and after blood administration. And blood should never be mixed with anything else. When you initiate the blood administration, you want your first 15 minutes of infusion should be at a slow rate to monitor if there is any blood reactions, any type of reactions, adverse reactions. And then after that 15 minutes, go ahead and take another vital sign. What am I trying to say? Take vital signs again. Okay. And then after that 15 minutes, then you can increase the flow rate. So the rate of infusion depends on 3 things: the patient's blood volume, hemodynamic condition, and the cardiac status of the patient. Blood should be administered within 4 hours and no more. Okay, so this is end of video 1, and I'm going to start video 2.